Hi, my name is Tracy G. I'm doing my final video presentation for public health. The topic that I chose to speak about is prescription drug overdose. This is a rising public health issue just within the last few years that it's really been brought to light. Now, last year in the U.S., there were more than 50,000 overdose deaths. These deaths are from opioids like painkillers. Oxycontin, Vicodin alone killed 17,536 people last year. That's an increase of 4% from the previous year. And nearly half of all overdose deaths include or involve a prescription opioid. That means the drug is prescribed and used illegally by the person or used in a manner that is illegal because they are doing more, but yet it's legally prescribed to them. So, I mean, they have a right to use it, but probably they're taking too much of it or taking it too often and become addicted to the prescription drug itself. Now, I did a little bit of research on states that prescribe prescription painkillers, and there's a lowest to a high level, and then there's like an average median level. The states that had the highest were more in the southern region, but you can't really pinpoint a certain area because it's all over the place. And I put that in my PowerPoint, the graph of it. It's actually a really cute graph. It's like a pill bottle, and it's got the different states in there, and it's got a number per 100 people, how much they're how many is prescribed in each state per 100 people that get those pain killing medicines. Then I did a chart on drug death. It's prescription drug death. It doesn't. I couldn't really find one that was specific and up to date on, or maybe I just didn't look in the right places, I'm not sure, but on prescription drug overdose deaths. But it gives you an idea of with the demographics of an age group and race. And the races are the white, the American Indian, African American, and Asian and Pacific Islanders. Now, the age groups go from 15 to 24 years, from 25 to 34 years, and then 35 to 44 years, 45 to 54 years, and 55 64 years, and 65 to 74 years, 75 to 84 years, and then 85 plus. Well, according to this graph, the highest was among the white race between the age of 45 and 54. Now, I don't really think that that's accurate for prescription drug overdose. I really do think that it's a younger generation that overdose from prescription drugs, but this could just be prescription death. It doesn't really specify. I'm not sure. So, but I know that the Asian and Pacific Islanders, they have the lowest amount through any age category. It's like almost minute that it's even on here. And I put on here the fact that the rate is not the highest among the younger people is interesting, since I think most people would think that they were at higher risk. Just because I wanted to make sure that I covered that's how I feel. I don't know if that's, the the truth in it, but that's how I feel. Um, then I went on about the behavioral and environmental factors behind prescription drug overdose. Um, Genetic, people who have like first degree relatives, such as a parent or a sibling who struggle with addiction, are at greater risk for developing an addiction, because they're more exposed to it and they have, that history. Now, physically, people who struggle with chronic health conditions such as pain related conditions, mental health disorders such as anxiety disorder, are a great risk for developing addiction to these prescription drugs as well, because they're prescribed them more often. They may begin using it to control their symptoms of the disorder, and then they actually um, start to rely on it. They kind of build up a tolerance and start to rely on it more than just for what am I trying to say? Every now and then thing. It's more of a every day, every so many hours thing. And the environmental stressors can have a huge impact on the development of addiction. People who begin to use or abuse drugs and alcohol in their youth are at greater risk for developing an addiction later in life. Um, Having a peer group or circle of friends who abuse drugs may influence someone out to abuse prescription medicine. So if all your friends are doing it, you may be more likely to do it because you want to hang out with them. You want to do the same things that they're doing. You want to feel like part of the group. That's, the peer pressure part of it. And not always true, but yet a lot of times it's more true than not. Risk factors. Addiction to other substances, say, this will make you more prone to become addicted to prescription drugs. If you have an addiction to something else, maybe alcohol, maybe another drug, maybe anything. Some people just get addicted to anything sometimes. If you have a lower income status, you live in like a bad neighborhood, I guess you might say. There's not a lot to do there, so that's part of the environmental as well. In younger ages, teens and early 20s seem to be more susceptible to developing an addiction or a problem with most drugs, not just prescription drugs, but most drugs as well. If you have easy access to prescription drugs, like maybe your mom takes them, maybe somebody that is abusing them is around you a lot and they're doing them, so you're going to do them. And if you have a lack of knowledge about prescription drugs, a lot of people don't understand what they're made from, what they're made for, why they're prescribed in the first place. Really, you just think, oh, it's a pain medicine. That's my pain medicine. I gotta take my pain medicine. So it seems like when you're prescribed something like that, I think you should have to have kind of like a sit down, which I guess you're supposed to with your doctor and go over it, but a lot of times it doesn't happen that way. Now, there are many social and ethical issues surrounding the use and abuse of drugs. These issues are made complex particularly because of conflicting values concerning drug use within modern society. Values may influenced by multiple factors, including social, religious, and personal views. Well, go get you some. Sorry. Political issues arrive with the monitoring and regulation of prescription drugs use. Now, I got sidetracked. Let me go back. You're welcome, babe. Um, the values. Okay, so not everybody thinks the same in society about everything. I mean, you may think the same kind of someone else, But I bet there's something in there that you just don't agree on. And a lot of times that's drug use. People have different views on that, especially people who may use the drugs. They, of course, are not going to see anything wrong with it, and people who don't probably do see something wrong with it. And maybe your religion affects you, even taking prescription pain meds, or there's certain medical things that your religion may prevent you from doing. Okay, and so political issues arise excuse me, with the monitoring and regulation of prescription drug use. I know at the clinic where I work, if you are getting a prescription narcotic, it has to be handwritten by your physician. They won't e-scribe it, which is, send it through the computer or through fax to your pharmacy. You have to actually come pick it up, show your ID when you pick it up that you are who is supposed to pick up the meds. And then when you go to the pharmacy, you have to provide your ID as well, because you're getting a prescription narcotic. I'm sorry. Um, so they monitor how often the patient gets this, how many pills they get, so they can keep track of how often they're actually taking their medicine, and if they're abusing those the meds too. Now, one of the current issues in medical ethics is doctors over prescribing prescription medication. Um, it's not been a concern in the past years, only in recent years that it's been an ethical issue of concern, mainly because if you look at the statistics of how many people in the U.S., I should have put a graph in here of that, but in the U.S. that take prescription painkillers, it's really high. It's just like antidepressants. It seems like everybody is taking something of that nature. So it seems like maybe you're passing out these pills when you should be offering some type of counseling, physical therapy, those kind of things, instead of just giving them the pain medicine first off, and maybe trying to do something other than that. Okay, let's move on. Now, what is being done to address this issue, and what does the future look like? Now, in 2015, the federal government launched an directive toward reducing opiate misuse and overdose, in part by promoting more cautious and responsible prescribing, which is what I just talked about. In line with the efforts in 2016, the Centers for Disease Control and Prevention published its guideline for prescribing opiates for chronic pain, to establish clinic standards for balancing the benefits and risk of chronic use. I think this is kind of exactly what goes on at the clinic, that guideline. Now, state regulations, prescription drug monitor programs are state-run electronic databases used to track the prescribing and dispensing of controlled prescription drugs to patients. So it's not just tracking the actual doctors, it's tracking the pharmacies too, because there could be some misuse in the pharmacy of giving out the prescription meds. And it's an important tool for preventing and identifying prescription drug misuse. Okay, and my last slide is, will this be helpful? I was like, will it be helpful? I don't need to put helpful. No one can say for sure, but the right steps are being taken, in my opinion, to make the prescription drugs more difficult to get. This may create a problem for people who are selling the prescription drugs, but oh well. I know many doctors, like family doctors, are choosing not to even prescribe pain killers anymore. They will actually send you to a pain specialist to do that, because they kind of just don't want to even get into it. They don't want to have to answer for prescribing painkillers. We actually um, try not to. When we get new patients, we tell them, if you're on this, we're not going to prescribe it to you. You need to go see a pain specialist, or we'll send you to a pain specialist, but we're not going to start prescribing you prescription painkillers. Okay. Now, prescription drug overdose is not likely to be at 0%. I don't feel that it will ever be at 0%. Would it be nice? Yes, it would be wonderful, but I don't think it ever will get there. But the efforts to get the amount down is on the rise, and the issue is being brought to the forefront in the U.S. And I think that's one of the most important things, is that people are knowledgeable and understand that there's a great concern with prescription drug use abuse and overdose in the United States, and that we need to really get a handle on um, this, because we lose a lot of young people. I've known, um, I've known a handful at least. In the last 3 years, one of my childhood friends that I grew up with right across the street from my mom, he died from it, but his wasn't really overdose. It was more somebody had put something in the drug and it killed him, and the person that he knew did it with him did the same thing. So I would just kind of like to get this out there and maybe help people understand that it is a big problem, and we are moving towards fixing it.